Well, you see, I had the privilege of studying clinical psychology, which is my basic training, in Geneva with Jean Piaget and André Ray, both required of all students which were supervised to be involved from the start of their training in a work of clinical observation, which was supervised on a long-term basis. This enabled me to appreciate the importance of a permanent monitoring of any methodology of observations, and of any theoretical hypothesis about the everyday clinic. And this is very important for the psychoanalyst as well. And I had barely finished my degree, my second degree in clinical psychology, when I was offered a job as a clinical psychologist in the school observation service of the city and canton of Geneva. And part of my practice involved looking after difficult children placed in a specialized institution. So I have been working with children in psychotherapy even before I started my analytic training. And when Julian de Guerra became professor of psychiatry at the University of Geneva, he invited me and other people as well to take part in a multidisciplinary research project on language disorders in children, which led to several publications under his direction. At the same time, I was able to enjoy monthly visits from René Dietkin and less frequently Serge Lebovici, both of whom were friends of Ajoria Guerra, invited by him. And so I was thus privileged to have immediately regular supervisions of my beginning child psychotherapy activity with two of the most brilliant practitioners in this discipline. I was really lucky. Then I started, of course, my analytic training, and right from the start, the first part of which I accomplished in Geneva, I was encouraged by my analyst, who was Raymond de Saussure, who was one of the analysts that with Marie Bonaparte created the Paris Society, and then the Federation, European Federation with Anna Freud and Anne-Marie Sandler. I was encouraged by him to take part in international activities, first of all, the IPA, and then the EPF, IPA, International Psychoanalytic Association, and then the European Federation of Psychoanalysis, which is set up with Anna Freud, as I said. I thus established links with European, North American, and Latin American colleagues, links that I have maintained and developed throughout my life. What is lacking in my experience is communication with Far East part of the world. Now people go to China or Japan, and I regret not to be able to be part of them, but really now I am too old. So during this Swiss part of my analytic training, I worked mainly with Olivier Flournoy, who was the supervisor of my first case and validated it, my first case of training. I worked also with René Henny, who was a fantastic child psychoanalyst. And I worked also, amongst others, with René Spitz, who just happened to stay for 6 years in Geneva. And he gave fascinating seminars during these 6 years. And I was lucky enough to have also a private supervision with him. Then I switched. I went to Paris for personal reasons in 1970, and I had to start a new course of analytic training because they didn't consider the part as valid, the part that was made in another society. It was not especially against the Swiss society, it was a principle at that moment. So I started all over again, but I don't complain about it because I had two fantastic supervisors, Michel Fin and Pierre Luquet, who was also a painter, an artist, and he was the head of the um, Congress of French speaking analysts at that time. I also worked with Janine Chasguet, Smirgel, and with André Green and James Gamil, mainly for my training in the British psychoanalysis Winnicott, which I met when I was a student when I was in London, but also Melanie Klein, which I didn't meet, but I met then Hannah Siegel and other people. I was very fortunate enough to work with James Gamil, who was in supervision with Melanie Klein for years and years. Well, in fact, I was also lucky on that on that opportunity because he left London to Paris and he established in Paris in the same at the same moment as I Meltzer and with whom I worked because I was the translator. During the sessions, and he came, Meltzer came 3 weekends each year
Paris.
for more than 10 years. His teaching has been for me something unforgettable. I also worked with Pierre Olanier, which I regret that she disappeared so quickly and too early, because she had very personal and creative ideas about, the creation of symbols and beginning of thinking of pictogram, exactly. I also was lucky because I was chosen to be part of the one of the two uh, meetings twice a year, meeting of the Center for Advanced Psychoanalytic Studies. It was called CAPSA. The acronym is CAPSA, Center for Advanced Psychoanalytic Studies, and it was a very particular meeting. We were meeting in England. In a beautiful little city on the Thames, and it was we were 12 of us chosen amongst the training members of European societies, and we were here to talk about quote unquote difficult cases, which meant, of course, cases of our colleagues that we couldn't talk about with anybody in our own society.
Mhm.
So I was lucky because in my group there was Janine Chasgues-Smirgel, Eric Brenman, Michael Feldman, and so on, and Moses Lofer. I was also very quickly involved to take positions in responsibility in my society, even when I was still a candidate. I was asked by the president of the time to be the representative of the candidate. And this was also important for me because I could see how a society works. Then I became twice vice president of the society. The first time I was very young and I learned a lot. The second time I was asked by Jean Cournu to become the next president. And I told Jean, give me 3 months and I'll give my answer. And then my answer was no. I said at that moment the society had become so complex that although meanwhile I had created two societies, two associations of child psychoanalysis, and I had been working with the COCAP, I knew that I was not the person who could take, the responsibility of the organization of the society, Paris Society. I refused. It's too bad to take something, to take a work that you know that you are not going to do properly unless you spend your whole life to that. I was involved, especially in child analysis, and I didn't imagine that I would just, stop all other activities and be involved in something that had become so complex that it really needed a constant attendance and attention. I haven't known Aberasturi myself. I worked with several Latin American child analysts and analysts, but I was in favor of this translation because I discovered how important the Latin American psychoanalysis had been, and that very often in Europe we don't know. We didn't know at the time, of course. Blecher, Racker, Blecher, and all these, so important psychoanalysts. And I have known Greenberg, the Greenbergs, the two of them. Béranger, no. I've never met them. I could have met Madeleine, but it didn't just happen. I worked with child and adolescent and adult analysts like Virginia Ungar. I worked a lot with her, and she found my idea to work on, to study on the infantile in the psychoanalyst interesting enough to persuade, when she was a president of the IPA, to persuade the IPA to have a congress on this team. So it
Exactly.
was. But in France, I also worked in private practice and in institution. May I mention that just at that moment, my work in the institute Edouard Claparède, because it's a link with the Swiss, Switzerland. Edouard Claparède was a Swiss, and the creation of this institute in Neuilly-sur-Seine was really a very, very good thing, and still nowadays it goes on, trying to keep psychoanalysis as much as possible in the foundation of the treatments that are made in this institute. If you want me to say something about it, I would say that I just happened to live, of course, now I was born 5 years before the Second World War. And although I was not in France or in a country that was in war, Geneva was just, if you know the geography of the Switzerland, Geneva was just between the occupied France, occupied by the Nazi, and the Italy, who Savoy, of course, but also Italy, who became the fascist allied of the Nazis. So my father was mobilized as a soldier, like all the Swiss men and some women as well, as on a voluntary basis. And so I didn't see my father much for 5 years, between my 5 years and my 10 years of age. And this played a role, an important role, because I knew that the French, the Swiss defense was organized on a basis of protecting the Alps and the Jura, but not the plateau, the part of the Switzerland where all the big cities are, including, of course, Geneva. So it was planned to, because they couldn't protect everything, it was planned to leave it to the German invasion just in case, and to fight to keep the rest of the territory. So it's not a situation that is very comfortable for a child of 5 to 10 years old. We had to go to the down in the caves. Not, we didn't suffer from hunger, but we had restrictions, and rather severe ones. Uh, but also we were given a kind of spirit of resistance. This is for the general framework. For the personal framework, of course, you can imagine that such a situation is not very good for the equilibrium of families. In fact, my parents divorced just after the World War II. My mother remarried with a man who had 2 children in charge, which was exceptional at that time. And I became the eldest one of 4 children. And of course, life was not very easy. So I learned my mother was a little bit overwhelmed by all that. And I was also uh, expected to help her with these younger children and their own difficulties, which were more or less important, some of them totally normal, but you can imagine in a reconstructed family, it's not always easy. And so this brought me to think that really children deserve a special attention.
Mhm.
That really children cannot express what they feel in certain situations, and that it's important to help them. The personal side of it. And the other thing is linked to what you mentioned, because I had an artistic culture. My mother was a violinist, and there are several musicians in my family. It's a way of listening. And I think here the artistic, not only music, but first of all music, to listen and to pick up what is right and what is not right, or what is true and what is not true. It's not always possible, but you develop this kind of listening. And I think that the way children express themselves, and especially the young children, is so artistic that I was, and I still am, fascinated by it. I don't understand how one can be analyst without being also trained in child analysis or interested in child analysis. This is also why I worked on the infantile and on the blind spots in the in the analyst, and because I think i- you you cannot be only a grown-up person. If you are only a grown-up person, all the what Freud brought is lost, because if you don't go back and forth between your grown-up part and your infantile, uh, in fact, what he discovered it was the infantile neurosis as a model of the transference neurosis. So if you forgot about the model, or if you think the model is made once forever, you're not right. I think you cannot really work. You cannot go on with your auto analysis, which is important when you are, especially when you are an analyst. It's an everyday habit. May I add something of my personal and present experience? The more I am getting old, and now I am 90, the more I'm getting old, the more very, very old souvenir, remembrance come back to me. And I discovered not only the fact, because I knew the fact, but the emotional impact it had, and it is still having, although it has been analyzed. And I see how it has shaped parts of me that I didn't think, with which I didn't think it was linked to such a point. And I'm not the only one, because I'm living in a fantastic place in which mad people like me decided to spend the rest of their life. It's really isolated, it's beautiful, and of course I have contact with not only but many oldish people, and they all describe something like that. When I listen with my analyst ear, I say, well, this comes from your infancy, not only childhood. First of all, I also was lucky, because when I started my training in Switzerland, it just happened that Switzerland was welcoming people from countries in which psychoanalysis had been suppressed by the Nazi. Uh, German, of course, but also Italians, French, Portuguese. We had Pedro Luzes, who was the first Portuguese creator or recreator of the Portuguese society. Spanish, many also. And you know, as we were all studying the same matter, we had links that were kept afterwards. And I might I would like to mention two very close friends who now are dead. It's Manuela Utrilla Robles, who was a very dear friend of mine, and more recently Marta Badoni from Italy, who wrote a fantastic book that I'm trying to have be edited in French. I translated, and it will be edited in English, published in English. I proposed the title in Italian is Prendersi in gioco, which is very difficult to translate. I proposed in English, Take the Game. You know, when you are playing together, either you accept the game or you don't. And her topic was, if you are an analyst, you have to accept the game, but you have also to check up that your patient is accepting the game as well, and this for each session. So this is also the basis for my interest of in many countries. May I add for you, Christine, that I also worked in Belgium, and I have many friends in this country, and very happy and lucky that you are discussing with me today. The child is very sensitive to the way one presents to him or to her, and also very sensitive to the link we can have with the parent who is with the child, if it's a very tiny child, or who is in the waiting room, but who is the agent of the meeting, in fact. And the more I work, the more I think that we have now, especially now, in this new society in which we are for almost 20 years, but with it's become quicker and more obvious now, to take care of the parents. And the problem was that we thought we had solved this situation with a very good organization that now is rather devastated by the politics of health, but that consisted of having a team with an MD or a psychiatrist seeing the parents and a psychotherapist seeing the child, and so on and so forth. But what I discovered was that if we investigate from a research point of view how it worked, in fact, it didn't work because 9 times over 10, maybe I should say 99 out of 100, parents don't affect the person who is supposed to talk with them. They affect the child's therapist. So we have to take, you know, Freud said that we have to take the cat in the bag, but we have to take the whole family of cats in the bag. And we have to do something with this transference of the parents because, of course, because of their infantile. And I remember when I was 25, I was not married, I had no children, and suddenly listening to parents, I realized that they were talking to their own parents and that I was the grandma. So I was terrified, but this is true, you know. Now I accept to be the grandma, but at that time it was a real discovery. Yes, yes. May I just be a little bit subversive because I would like to remind you how this sacrosanct history of this the session of the adult session as being a sort of dogma, how it happened, because you know, once I was lucky enough to listen to Raymond de Saussure and René Spitz speak together in Geneva at a dinner, speaking of their analysis, their respective analysis with Freud. Now, first of all, René Spitz said, "Oh yes, Raymond, you were lucky enough to have 1 year of analysis with Freud. I had not enough money, so I only spent 6 months." Then they recounted that once Freud gathered all his analyzants together and he asked them, "Would you accept? I have a demand from Marie Bonaparte to have an analysis, but I don't have more time because I work from Monday morning to Saturday night. So I'm going to ask you whether you would accept to give her one of your sessions." Which meant that they had 5 to 6 sessions, and then they had one less because Marie Bonaparte was coming, you know. Then Freud said one day, it's awfully tiring to have these analyzants in front of me. I cannot, scratch my head or um, feel irritated, or so I decide to take my armchair and put it back. So it was for the sake of the analyst, not for the sake of the patient. And of course, people didn't stay much, even if they had money, they didn't stay more than 1 year with Freud. Now, we pretend that it's the sacrosanct dispositive of the session. It has to be like that. The analyzer has not to see the analyst and so on. But we forget in which circumstances it has been organized and for the sake of whom. So now the society has collapsed, and if we read Freud or in what he wrote on society, we see how clever he was and how he had foreseen that, So this model, this is just to say that this model is not the Graal, it has not to be taken as, well, is it possible to bring child analysis to this model? Not. It is, we just have to be more modest, but also probably more demanding on our possibility to be analysts. We should be able to be analysts in any situation. This is the asymptotic line I would suggest. It doesn't matter in which position you are, if you are in front of the patient or not, and then, of course, you have all the discussion, is it a psychoanalysis or a psychoanalytic? It's just useless. Sometimes we are real analysts, sometimes we cannot, we do not succeed. We are just trying to contain a very difficult situation. Sometimes suddenly we understand something and we can communicate about it or not. So I would see the things like that. It is very complicated. Yes, I thought about it because we had our first meeting a few days ago, and I understood totally the anxiety about the question Teresa made at that moment. What should we teach to the young candidates, to the young people who want to become analysts. And I would say that I don't know. I would have a tendency to think first of teaching them to listen, to feel, to be close to their own feelings, to their own sensations. Now we know with the neuroscience that we have a memory that is much earlier, that is previous to the birth. It's a memory that Melanie Klein had of which Melanie Klein had the intuition when she was talking of memories in feelings. In fact, it's even more earlier. It's memories in sensations during the fetal life. So we know that we cannot just say when a child is born, it's a new page that is beginning, which is true, of course, but nothing happened before, which is false, which is wrong. So this kind of sensibility has to be taught, and it's difficult to teach. I mean, some people, this is the side of the psychoanalysis being both an art and a science. This is on the artistic side, so to speak. Either you are gifted to listen, or you have to be trained. And sometimes it's successful, sometimes it's less successful.
Mm-hmm.
The other thing that we have to teach is also that there is no analytic work, whatever his name, that avoids tragedy. And if we are not in a tragedy, which is the most acute point of the conflict, we are not facing our duty of analyst. You see, Meltzer was saying, don't think that coming from the paranoid schizoid position and switching to the depressive position, it's heaven. We just change the kind of suffering. We have to know that it's not a garden of roses. It's
Mm-hmm.
just a changing of suffering. That we switch from one that is sterile, who doesn't evolve and who doesn't produce,
Yes.
who is not creative, to another way of suffering that prevent uh, helps us to mourn the past, to accept the time, to accept reality, and to go on discovering new things. So I think it's worth it, you know.
Mm-hmm.
But it's quite a job. So after that, I was just dreaming of something that would be could we teach our young candidates to become able to tell their patients, now you tell me that you only have once a week to give for our work. I think it's not enough, but I can't be at your place. Now let's try, but give me the possibility to tell you that it's not enough and to propose you a second one, then maybe a third one, and maybe a fourth one. When I started analysis, first of all, made an acting out. I married instead of beginning analysis. Then 3 years later, I came I was totally upset. And I asked for analysis, and Raymond Saussure said, okay, but I cannot see 4 times a week, which was the rule in Switzerland at that moment. But I don't mind being a candidate. I just need analysis. And he said, okay, but for the time being, I only have 3 times a week. And after 1 month, I asked him, I told him, any time of the day of the night, but please give me a fourth session because I can't stand this. Well, I think the main thing that has changed is the structure of the family, the structure of society. The brick of the structure of the society used to be the family. And now, for 50 years, family has been destroyed more and more, destroyed, reconstructed, and redestroyed, and so on. So society has changed, not only because of that, but mostly because of that uh, difference in the material of the structure, which means that children don't have the same security in their uh, close environment as they used to have, even if this security was sometimes pathological, with a father too authoritative, or a mother who was neurotic and so hysteric, with all the studies on his history. Women work, and society doesn't help them very much to keep on being mothers, and being also part of the society to which they bring their capacities and knowledge. I mean, it's also a gain for the society. It's not only for the for the freedom of women. So we have to consider that when we see a child, we have to see how its close uh, environment is working, and we have to understand how it works. So it brings us also sometimes to have a family of placement, to have a judge who decides whether the child has to see his father or mother or not, which is a fantastic responsibility. I mean, I would not be obliged to assume that very often. And so we have to adapt to that society. The worst would be that we decide that it's too much for us and we give up. Now you know that so many adolescents are really in so difficult situation and the confinement with the COVID has increased this disarray. And so we have to be there and we have to do what we can do. Then we try to put a framework. Then we have to say, well, it would be really better if we could meet us more often. Of course, we are in a period of time in which we have to be convinced of the existence of the unconscious, to be convinced of the after effect of the traumas. So we are more orientated towards, we're attentive towards traumas, because there are plenty of it. And about the unconscious, it's very difficult, because in fact, the AI, artificial intelligence, has contributed to many positive things, but also, unfortunately, to a negative one, which is to make to give the belief to people that all that is inside can be put outside, and you can, as you know, as if you were sort of turning over a glove, inside out, and that everything that was inside is now out, and you can put it in little boxes called algorithm, which a sociologue has called, it was the title of his book, with whom I don't agree totally, but the title is fantastic. The flattening of the world. So it becomes bidimensional. And we know since Bean that if we don't have three dimensions, we don't have the possibility to have the acknowledging of reality, the existence of reality, and of course all the Oedipal complexity, not only of relationship, but also of its complementary, unavoidable complementary of identifications of two parents, one man and one woman, is not possible. So it's a big question, because if we don't believe of that unconscious exists and has its own way of working, own way of living, we cannot be psychoanalysts. We are going to be behavioral therapists and give advices of how to behave in order to adapt to a society that we consider as being the alpha and omega of life, which of course is not true. Yes, of course, it was on purpose that I brought this, because it's the typical example of the difference of functioning between external facts, external appearance, external behavior, external, yes, behavior, and internal unconscious functioning. What I mean is that we all need to acknowledge that we have masculine parts and feminine parts, and we have masculine identifications and feminine identifications, and it could be of some help to acknowledge them, just when we think about them, in order to accept that we are a mosaic of things, and that we accept also to have masculine points of view, when even though one is a woman, and vice versa, which is also very useful and not always not always very productive. Yes. Now, after that, whether you are homosexual or heterosexual or bisexual, it's just your choice. I mean, it doesn't it doesn't change the fact that for your it could be difficult for the balance of your identity, but I must add immediately that I don't know anybody who hasn't difficulties to balance one's identity. And I always described identity as something moving, and I have the metaphor of something that I learned, that in a forest, the trees are moving constantly, day and night, in order to adapt themselves to the environment of the other trees and all the bushes and all the in order to share the space. So I had this image, and recently I listened to the lessons of Wajdi Mouawad to the Collège of France, and who said, in fact, for me, identity is never fixed until the day of our death, which I think was much better than my metaphor, because it's definitive. So don't worry if your identity is not fixed. The problem is that if you try, then you have the choice of the means you use to fix your identity, because the suffering of not feeling well in our identity is something that can be very, very deep, this suffering, and I respect this suffering totally, 100%. The only thing is that I would add just the first principle of medicine, primum non nocere, not be a nuisance to the person first of all. So keep most of his or her capacities to develop. This is just I'm not, I'm against everything that would sort of make this person crippled in a way or another. Don't feel discouraged. Don't feel discouraged. Keep on working together. Keep on working in groups. Keep on presenting your clinical work to other people in a state of mind where it's not a question of judgment. You don't judge each other. Always respect the fact that the person who presents is the analyst, even though it can be very young, unexperimented, or so on. You cannot replace this. You cannot be in his or her place. Never, ever, ever. So learn, maybe increase the work in groups, in small groups, in larger groups, in order not to feel totally lost, because the society is going to be still probably harsher with us, and we have really to feel that we are a community.